What if the pill you take every morning is slowly damaging your brain? Not over decades, but in as little as 90 days. Right now, millions of Americans are swallowing medications they believe are completely safe for conditions like high blood pressure, insomnia, and chronic pain. But groundbreaking research is uncovering an alarming truth. Certain common drugs may be silently eroding memory, cognition, and brain health long before any obvious symptoms appear. A landmark study recently revealed that several widely prescribed medications increase the risk of cognitive decline by up to 70%. The most troubling part? Many doctors still consider these drugs perfectly safe and prescribe them routinely to older adults. This video reveals the 9 medications most strongly linked to cognitive impairment, including one that researchers found causes measurable brain volume loss after just 6 months. If you or someone you care about is taking any of these, you really need to understand the real risks and know exactly what to discuss with your physician before permanent damage occurs. First up, opioids. Common medications in this category include oxycodone, OxyContin, hydrocodone, Vicodin, morphine, Mississippi Contin, fentanyl, Duragesic, and codeine. 3 years before her diagnosis, 68-year-old Margaret was prescribed oxycodone following hip replacement surgery. Initially, it was just for post-surgical pain, but she continued refilling the prescription to manage ongoing discomfort. Over time, her daughter noticed troubling changes. Margaret would lose her train of thought mid-sentence, stare blankly during conversations, and once put her house keys in the sugar bowl. Her normally vibrant personality became subdued and distant. By 71, a neurologist confirmed Margaret was experiencing early-onset dementia. Research indicates that extended opioid use is associated with up to 45% accelerated cognitive decline in older adults. These medications don't simply block pain signals, they fundamentally alter brain chemistry. Opioids disrupt the connections between neural regions responsible for memory formation and emotional regulation. Long-term use forces the brain to adapt by downregulating key receptors, essentially rewiring itself in ways that compromise cognitive function. The resulting damage manifests as processing delays, memory failures, and diminished executive function, often progressing so gradually that families attribute the changes to normal aging until the impairment becomes impossible to ignore. Next, benzodiazepines. Common medications in this category include diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, clonazepam, Klonopin, temazepam, and Restoral. 4 years before his diagnosis, 70-year-old Edward began taking lorazepam for anxiety following retirement. The medication initially helped calm his nerves, but his wife soon noticed peculiar behaviors. Edward started placing everyday items in bizarre locations: TV remotes in the refrigerator, shoes in kitchen cabinets. He repeatedly asked the same questions within minutes and became disoriented in the shopping mall where they walked weekly. When he began accusing neighbors of stealing his newspaper, which he had actually canceled months earlier, his family sought medical help. At 74, Edward was diagnosed with moderate cognitive impairment. Clinical studies have consistently linked benzodiazepines to a 25 to 80% increased risk of dementia, depending on dosage and duration of use. These medications work by enhancing the inhibitory neurotransmitter GABA, effectively dampening neural activity. While this mechanism reduces anxiety, it simultaneously suppresses the brain regions responsible for forming new memories and maintaining cognitive clarity. Neuroimaging studies show that long-term benzodiazepine users experience accelerated brain volume loss, particularly in areas crucial for learning and memory. Despite mounting evidence of these serious risks, benzodiazepines remain among the most commonly prescribed medications for older adults, often continued for years without regular re-evaluation of their necessity or impact on cognitive health. So let's talk about muscle relaxants. Common medications in this category include cyclobenzaprine, Flexeril, carisoprodol, Soma, methocarbamol, Robaxin, Baclofen, Lioresal, and tizanidine, also known as Xanaflex. 4 years before her diagnosis, 75-year-old Helen started taking cyclobenzaprine for persistent back spasms. Within months, her family began noticing some strange behaviors. Helen would misidentify familiar objects, calling her toothbrush a pencil or her refrigerator a closet. She mixed up her grandchildren's names and at one point even attempted to make coffee with cold water and no coffee grounds. When she began wandering in her neighborhood and couldn't recall her address, her son insisted on a medical evaluation. At 79, Helen was diagnosed with early-stage vascular dementia. Now, research published in the Journal of Neurology found that regular muscle relaxant use was associated with a 40% higher risk of developing cognitive impairment in adults over 65. These medications work by inhibiting central nervous system activity, which relieves muscle tension but also suppresses crucial brain functions. The sedating effect is particularly potent in older adults whose brains already have reduced metabolic activity. Prolonged use essentially trains the brain to operate in an artificially slowed state, gradually eroding neural pathways necessary for information processing and memory recall. What many consider a harmless solution for occasional muscle pain can, when used regularly, compromise the very neural networks essential for maintaining cognitive function into older age. First-generation antihistamines are another class to be aware of. Common medications here include diphenhydramine, Benadryl, Unisum sleep gels, chlorpheniramine, chlortrimidine, hydroxyzine, Vistaril, promethazine, Phenergan, cyproheptadine, and Periactin. 5 years before his dementia diagnosis, 72-year-old Arthur began taking an over-the-counter sleep aid containing diphenhydramine every night. He considered it completely harmless, just a common pharmacy item for better sleep. Within 18 months, his daughter noticed he was asking the same questions repeatedly during their weekly calls. Arthur began misplacing important items like his wallet and house keys, then accusing family members of moving them. The situation worsened when he got lost driving to his doctor's office, a route he'd taken monthly for years. By the time his family recognized the severity of his symptoms, Arthur was already showing significant signs of cognitive decline. Comprehensive studies have revealed that regular use of first-generation antihistamines increases dementia risk by up to 50% in susceptible individuals. These medications cross the blood-brain barrier and block acetylcholine, a neurotransmitter essential for learning and memory formation. The anticholinergic effects are particularly damaging to older brains already experiencing natural reductions in acetylcholine levels. What many don't realize is that these medications, often marketed as safe sleep aids or allergy remedies, can accelerate cognitive aging when used consistently. The cognitive changes often begin subtly: occasional word-finding difficulties or misplaced items, easily dismissed as normal aging, before progressing to more pronounced memory failures and confusion that signal significant neurological damage. Now let's look at sleep medications. Common medications in this category include Zolpidem, Ambien, Azopiclone, Lunesta, Temazepam, Restoril, Zaloplan, Sonata, and Doxepin, also known as Silanor. 3 years before her diagnosis, 69-year-old Barbara started taking Zolpidem nightly for persistent insomnia. Within weeks, her husband noticed disturbing changes in her behavior. Barbara would wake up disoriented in the middle of the night, rearranging furniture or sorting through closets while not fully conscious. During the day, she struggled to recall recent conversations and began mixing up the names of close friends. When she started using household items inappropriately, like attempting to charge her cell phone with a TV remote or putting dishes in the washing machine, her family sought medical advice. At 72, Barbara was diagnosed with mild cognitive impairment that continued to progress despite discontinuing the medication. A large-scale study published in JAMA Neurology found that regular users of certain sleep medications had a 30 to 45% higher risk of developing dementia compared to non-users. These drugs disrupt the natural sleep architecture, particularly reducing critical slow-wave sleep necessary for memory consolidation and clearing brain toxins. Even more concerning, these medications alter gamma-aminobutyric acid, or GABA, receptor function, potentially causing lasting changes to neural signaling pathways even after the drug is discontinued. While many view these pills as a harmless solution for sleepless nights, emerging research suggests they may be compromising the very brain restoration processes that healthy sleep should provide. For older adults already at increased risk for cognitive decline, the neurological price of medication-induced sleep may be far higher than previously recognized. So, let's talk about statins. Common medications in this category include atorvastatin, Lipitor, simvastatin, Zocor, rosuvastatin, Crestor, pravastatin, Pravachol, and lovastatin, Mevacor. 3 years before his diagnosis, 74-year-old Raymond began taking high-dose atorvastatin after a routine cholesterol screening. At first, there were no obvious side effects, but his wife gradually noticed some concerning changes. Raymond started forgetting appointments he'd written down, misplaced his glasses multiple times a day, and developed unusual eating habits, like, once, spreading peanut butter on a steak. The most alarming incident happened when he woke his wife at midnight, frantically insisting that strangers were living in their attic. After comprehensive testing, Raymond was diagnosed with early-stage dementia at 77. While statins are effective at managing cholesterol, research suggests that high-dose long-term use in some older adults may be associated with a 15 to 30% increased risk of cognitive changes. These medications reduce not only cholesterol but also coenzyme Q10 and dolichols, compounds that are really essential for mitochondrial function and neuronal health. Some researchers theorize that excessive lowering of brain cholesterol may impair synapse formation, since cholesterol is a critical component of healthy neural membranes. The cognitive effects often develop subtly. At first, there might be mild forgetfulness or occasional confusion before potentially progressing to more significant impairment. This presents a complex clinical dilemma, since the cardiovascular benefits of statins must be carefully weighed against potential cognitive risks, especially in older adults already experiencing early memory changes. Proton pump inhibitors are a class of medications commonly prescribed for acid reflux and heartburn. Some of the most familiar names in this category include omeprazole, Prilosec, esomeprazole, Nexium, pantoprazole, Protonix, lansoprazole, Prevacid, rabeprazole, and Acifex. Now let's talk about Eleanor. 4 years before her diagnosis, 76-year-old Eleanor had been taking omeprazole every day for acid reflux. At first she noticed that food tasted different, metallic and honestly just unpleasant, even when she ate her favorite dishes. Soon after, more worrying symptoms began to show up. Eleanor started accusing her husband of tampering with the thermostat whenever she felt too cold or too hot. She even began hoarding unusual items like empty pill bottles and hiding them throughout the house. Eventually, she became confused about basic household tasks, things like how to use the microwave she'd operated for years. At that point, her daughter insisted on a medical evaluation. By the time Eleanor turned 80, she was diagnosed with moderate cognitive impairment. Research published in JAMA Neurology found that people who use proton pump inhibitors long-term have a 44% higher risk of developing dementia compared to those who don't take them. These medications might impair cognitive function in several ways, by reducing vitamin B12 absorption, which is essential for neurological health, by increasing the production of beta amyloid, the protein that forms Alzheimer's plaques, and by altering the gut microbiome in ways that affect brain function through the gut-brain axis. What's particularly concerning is how often PPIs are prescribed for indefinite use, even though the FDA recommends limiting their duration. Many older adults remain on these medications for years without any reassessment, potentially accumulating neurological damage while focusing only on digestive symptoms. Antipsychotics are another group of medications with hidden risks. Common drugs in this category include risperidone, Risperdal, olanzapine, Zyprexa, quetiapine, Seroquel, haloperidol, Haldol, and clozapine, Clozaril. Let's look at William's story. 2 years before his diagnosis, 73-year-old William was prescribed quetiapine to manage agitation related to early dementia symptoms. While the medication initially helped calm his nighttime restlessness, his daughter soon noticed a rapid acceleration in his cognitive decline. William started struggling to recognize close family members, forgot how to perform basic tasks like brushing his teeth, and developed paranoid beliefs, like insisting that his reflection in mirrors was actually an imposter watching him. By 75, his cognitive deterioration had progressed dramatically, moving from mild impairment to moderate dementia. Multiple studies have shown that antipsychotic medications can significantly speed up cognitive decline in older adults, with some research suggesting a 60 to 70% faster progression of symptoms. These drugs work by blocking dopamine receptors, which helps control agitation but also impairs neural pathways that are essential for cognition, movement, and motivation. Brain imaging studies have found that antipsychotic use in older adults is linked to accelerated gray matter loss, especially in regions crucial for memory and executive function. The tragic irony is that while these medications are often prescribed to manage behavioral symptoms of dementia, they may actually make the underlying cognitive condition worse. For vulnerable older adults, the apparent behavioral improvement may come at the cost of even faster neurological decline. Tricyclic antidepressants are another class of medications with significant risks for brain health. Some common examples include amitriptyline, Elavil, nortriptyline, Pamelor, imipramine, tofranil, doxepin, Silanor, and clomipramine, anafranil. Take Catherine's story, for example. 3 years before her diagnosis, 74-year-old Catherine began taking amitriptyline for persistent nerve pain. She had always been intellectually sharp and fiercely independent, but within just a few months her son noticed subtle changes. Catherine would misplace words mid-sentence or forget recent conversations. These changes gradually got worse. She started leaving stovetop burners on after cooking and once wore her bathrobe to a doctor's appointment, insisting it was her best dress. When she couldn't remember how to operate her cell phone, a device she'd used daily for years, her family insisted on neurological testing. By age 77, Catherine was diagnosed with early-stage dementia that continued to progress steadily. Research has consistently shown that tricyclic antidepressants have strong anticholinergic properties, potentially increasing dementia risk by 30 to 50% with long-term use. These medications block acetylcholine receptors, disrupting a neurotransmitter system that's critical for memory formation and cognitive processing. For older adults whose brains already produce less acetylcholine naturally, this kind of interference can really speed up cognitive aging. Despite the availability of newer antidepressants with fewer cognitive side effects, tricyclics are still widely prescribed, especially for chronic pain, insomnia, and migraines. Many patients, and honestly even some healthcare providers, aren't fully aware of the potential long-term cognitive risks, focusing instead on the immediate benefits for pain or mood. Some medications truly save lives, but others might be silently damaging your brain health day after day. Most people have absolutely no idea this is happening. That's why it's essential to ask your doctor, could this medication be affecting my thinking or memory? Because by the time noticeable cognitive symptoms develop, significant brain changes may have already occurred. And there you have it. What do you think about these hidden medication risks? If you found this information valuable, don't forget to check out our next video on natural strategies to protect your brain health and cognitive function. You won't want to miss these game-changing tips. Thanks for watching HealthWise, and we'll see you in the next one.